Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Aging Strong, which is sponsored by the Quincy Health Department. Today, I have a special guest speaker. Her name is Emily Shank, and she is from the Boston Public Health Commission. She's also an injury prevention coordinator like myself. So today, she's going to be talking about a very important topic that not too many people really talk about, and it's really, really important. Of course, that's why that's why I'm inviting her over. So I hope during our time with her, there'll be a lot of ahas and ways for you to kind of look around your surroundings for extra safety and prevention. So Emily, welcome.
Thank you.
So I know you have a PowerPoint presentation to share with us. So as you're pulling that up, I was wondering, can you share with us briefly how you got into this line of work, injury prevention, and more importantly, the topic and the population that you serve?
Yeah, so I originally got into this work because I was previously an emergency medical technician, so an EMT down in Virginia. And I'd always wanted to get into public health, and I had worked a lot with older adult populations, specifically around older adult falls. Which kind of led me to this position. And in being in this position, I've learned a lot more about injury prevention, especially across the lifespan. At BPHC, we focus on health throughout the lifespan, so injury from infants all the way to older adults. And so I'll be talking a little bit more about the child side of things today. But yeah, so originally it was responding to calls that got me interested in the education aspect of things. Today we're going to be talking about preventing window falls in particular. And as we talked about, my name is Emily Shank. My email is eshank@bphc.org if you ever need to reach out to me. And I am the injury prevention coordinator for Boston Public Health Commission, which is a division of the city of Boston. We were first, founded by Paul Revere. He is our first commissioner. We have over 40 programs, over 1,000 employees. We work from people on the ground doing EMS all the way up to our commissioner who helps advocate and work with the mayor on behalf of public health for the city. Our mission is specifically to work in partnership with communities to protect and promote the health and well-being of all Boston residents, especially those impacted by racism and systemic inequities. So that's a little bit about our organization, if no one's ever heard of it before. Today we're going to be going over window falls and the statistics of those, some window safety tips specifically for children, what window guards are, our specific program and its impact, the action steps you can take after hearing this presentation, and then we'll talk briefly on window cover strangulations and what retrofitting is, and then I'll share a few resources at the end. So to start, a lot of people maybe don't know what window falls are or the impact of them. And so even though it might not be something we hear about a lot, there are thousands of children that fall out of windows in their home or homes that they frequent a lot, between 3,000 to 5,000 around the US a year. And those are specifically in hospitalizations. So we assume that there's a lot more falls, but we don't maybe know if it's specifically from windows or they maybe just don't become severe enough to where a child needs to be hospitalized. And then windows are one of the 5 top home hazards. So it's one of the things you really want to think about when maybe childproofing a home. Window falls are 100% preventable. Some things we can't always prevent, but window falls are one of those things that if we take the steps that are outlined today, we can make sure that this does not happen. And there are, certain mechanisms like a window guard that you can have in place to stop a fall, but there are also practices that you can do to limit the chances of a fall if maybe window guards are not a possibility for you. And then for general recommendations, we are specifically concerned with children under 10 who live in a second story apartment or living situation or above because they're most at risk. So if you have children that are maybe over 10 or are solely on the first floor or with windows under 12 feet, you can definitely take these practices away, but they maybe don't have the highest risk. So to start, like we talked about before, there's around 3 to 5,000 window falls that are hospitalized, but we predict about 40,000 emergency department visits from window falls around the nation every year. Children under 5 years old are the most likely to fall out of windows. And then although window falls have a low occurrence rate, they have a very high risk for death and disability, especially for TBIs, or what we refer to as traumatic brain injuries. And that's also specifically for city populations that we have a focus on because the children are more likely to fall onto like asphalt or concrete or a harder surface that would lead to a traumatic brain injury. It's also important to recognize that BIPOC children and those on the autism spectrum are disproportionately affected. So children of color or those with disabilities, especially autism, are going to be more likely to have falls and typically are going to have more severe falls as well.
Emily, before you move forward, why do you think people of color, the children, are more likely to fall out of windows? What are the thoughts around that?
Yeah, so when we talk specifically about people of color, we have to recognize what we call social determinants of health. And so the fact that marginalized people groups are going to have less access to one, safety equipment, because as we'll talk about, window guards are pricier. They're also going to be more likely to live in those city environments, in, maybe apartments that don't have as much safety involved or maybe are on a higher floor. So they're going to have, more severe injuries if you fall out of a third story window in the city versus like a first story home in the countryside. And in addition, like a lot of times, as we'll talk about later on, people who are in, say, like public housing or maybe are living in some type of shelter. We now in Boston have window guards, but a lot of times if they're in these homes, they have less control over some of the safety factors or the ability to put window guards in. So that's typically how we see it, is just the people not having a lot of control over their living environment in order to make it safe is why we tend to see that.
Yeah. And do you think also for that population, are they less likely to afford air conditioning and therefore would open their windows when it's hot for some fresh air? And
Yeah, I'm sure that's definitely a part of it too. I know specifically for Boston, like AC is definitely a luxury. A lot of old homes do not have it, and so definitely people who are not in one of the like newer buildings are going to have to open their windows in the summer too.
yeah, yeah. Thank you.
Yeah, of course. So yeah, speaking of which, we'll talk about some safety tips so that people who, maybe don't have that AC and have to open their windows in order to stay cool or to get some sleep. We'll go over ways you can do that that is going to be safer. So first, you want to always open them from the top instead of the bottom. That way, like if there's 2 inches of opening at the top, it's going to be a lot harder for a child to get up there and fall out of it than if it's just on the bottom and they're able to like stick their hand in or push it up. So always do the top. And then you also don't ever want to have furniture below a window. So sometimes we'll see that children have like their beds under a window, and then that allows them to like stand up and to pull on windows, to open them themselves, or to, play with the windows and like maybe put their hands out if it's open. So by taking away furniture, children aren't as easily able to get up there and start messing around with the windows. We like will also sometimes see kids climbing on desks or a dresser. So you definitely don't want anything by the windows that a child can climb on and reach. You also always want to lock them when they're closed. Kids are very curious, especially kids with autism spectrum disorder, ASD. They can be very drawn to windows and find that very interesting. So you obviously are not going to be able to have an eye on your child or grandchildren 24/7. So making sure that they're locked and that they don't have a way to open the window is going to be one of the best ways to keep that window closed and to keep the child safe if you can't have other safety things in place. If you are able to always keep an eye on your children, that's best. Specifically, we're talking about when they're playing or awake. You definitely don't want children to be playing around with windows. We typically see window falls a lot from the children's bedroom, the parents' bedroom, or like a living room or play area. So a lot of times it's when they're awake and they're curious that a fall may take place. And then something that's very interesting is you only need 4 inches of open window for a child to fall out. So even if you think, it's only open this big, it's not that much. If a child can get their head through, that's all they need to fall out of a window. So we recommend like never more than 2 inches. All right, and so next we're going to be talking about window guards. So we recommend that the previous safety tips we talked about that you're always using, especially if there are children in the house of any age. But specifically for those kids that are 10 and below, we really recommend that you have window guards on all of your windows that are above 12 feet. So what these window guards are essentially in this little picture right here. Oh, sorry. Let me go back. So there are these little guards right here in this picture. Something that's important to know is these are removable and they do have an emergency release. So if you're worried about fire emergencies, that's not a problem here. They're able to withstand 150 pounds of pressure. Sometimes people will see like those bug screens and believe that since there's a screen on the other side of the window that a child will be safe if they fall or maybe less likely to fall, but those screens typically can only withstand 15 pounds of pressure. So if you have a child that is, more than 15 pounds or falling at a force, a bug screen is not going to keep them in. The 150 pounds of pressure is primarily going to keep any child under 10 from falling out of a window. It's also not the same as security bars. So as we talked about, they are removable. This model, they're going to have little like metal buttons that you push down and then you push it in on both sides so you can take it out. But most kids under 10 are not going to have the strength to do that or the ability to reach up and do that, which is why it's really important that kids who are, 5 or under especially have these bars because they won't have the ability to take them off. It's also installed in the walls. So these white metal things on the side are going to be drilled into the walls, which is going to give you an extra sense of security because they won't be able to move if they're correctly installed. And then Safe Kids Sacramento, which is an organization Safe Kids is an organization we work closely with. They say window screens are meant for keeping bugs out and not children in. So like what we talked about earlier, those 15 pounds of pressure that they can keep bugs out versus 150 pounds of pressure that are going to be keeping children in. All right. And so window guards are also the main form we recommend as a child safety mechanism. There are other things that people may talk about, like window stops, which are good, but at the end of the day, they're not going to be something that's directly in front of a child, keeping them from falling through a window. So it is the number one thing we recommend for households with kids under 10. And next, we're going to be talking about a BPHC specific program we offer for people in Boston. So This specific program that is under the injury prevention program is for window guards and to offer them at a subsidized rate for any resident in Boston. This program has existed for over 30 years and originally came to be because in the span of 6 months, we had 18 children fall out of windows throughout the city of Boston. And so at that time, there was a really big recognition that this is a health disparity that the city needs to address. So around 30 years ago when this happened, the program came to be. And since that, we have sold hundreds of window guards, not only to small landlords, but also, as we talked about, the Boston Housing Authority, which is the city's subsidized housing system. They have window guards that should be offered to all families with kids under 10 years old. And we've also worked alongside a lot of other housing corporations to make sure that they're offering window guards. And that's where we've seen a really big reduction of falls. But you just have to be a resident of Boston to qualify. So most people, especially small landlords or individuals, can qualify for this. And something that's really interesting is this is one of the only programs in the whole state of Massachusetts that offers window guards for a subsidized price. And if you haven't heard of Boston Building Resources, that is the distributor we work with in Boston. They're located in Roxbury, and so it is a partnership we do with them, and we really couldn't do it without them being in the community and storing these window guards for us. So we really like to uplift our partnership with them as well. So what it is essentially the city will pay for 50% of every window guard that we sell. Typically, each window guard is going to be between $50 to $80. Most houses we anticipate will have 8 to 10 windows in the bedrooms and common spaces combined. So that can be sometimes $500 to $800 depending on what size your windows are and how many you may need. As we talked about earlier, for a lot of lower income people or landlords, that is not an affordable price to be asking people to pay. So we do our best to discount them to make them more affordable so that people can have these safety features in their home while not, completely paying a price that is unreasonable. So we'll pay 50%. So if the window guard is $50, we pay that $25. And a lot of times we recommend that people reach out to their landlord and have their landlord reach out to us to purchase them or to Boston Building Resources. That's because people may move out, but these are reusable. You can install them, reinstall them. And so even when a family moves on, it's great to have that window guard in the landlord's hands for if another child is to move in the future. And then, we recommend it for people who are renting, but people who own homes should have them as well if they have small children. We also recommend that if small children are spending a considerable amount of time in your house, that you also have them. So like if grandparents are watching their grandchildren, a few hours a day or a few hours a week, it's always better to, have a window guard and never need to use it than to wish you would have had one in a bad situation. So if you're able to buy a window guard, we highly recommend it. And so from that, we're going to go over some action steps. So if you're renting, whether that's in Boston or in general, you want to contact your landlord about possibly getting window guards if you don't have them already. If you are in Boston, you can, and your landlord is in Boston, they can reach out to us about getting them for the subsidized rate. I will say that even if you're not in Boston, you can still buy window guards from Boston Building Resources. We just can't offer the subsidized rate for you guys. So it would be full price. But if you want these window guards and you don't know where to get them, you can go to Boston Building Resources and still purchase them. We can just only offer it to people who live in the city because we're a city program. And then if you live in Boston Housing Authority building, you want to submit a work order request to them, and that is because we already have a policy with them, so it should be provided. But if it's not, you can reach out and let your manager know or submit a work order in order to get that. I would suggest reaching out to a housing manager as well if you're in a different type of subsidized housing and you would like a window guard. I'm not sure what the specific policy is for, every housing unit, but hopefully that there is a policy, and if not, they can always reach out to us and we again can sell them. Depending on where they are, it might not be a subsidized rate, but we can always, help guide them in the right direction if we can't help with that. And then some things you'll want to know before you purchase a window guard or pick it up is the size of your windows. So from one end to the other, you want to measure that, and then also the amount of window guards you need and of what size. That is because they can come in sizes small, medium, large, and extra large, depending on the type of window. And so if you get a small but you need an extra large, you're not going to be able to install it, and then it's not going to be helpful. So if you measure beforehand, that makes the process a lot easier. And then after reaching out to your landlord about this, or if you're a homeowner and you want to purchase a window guard, you can reach out to Boston Building Resources. There are distributors, so they have them there. And that is their number. You can also visit their location. And that is the majority of the information that we wanted to cover for the window guard program. Next, I'll just be going over a few safety things to keep in mind for window covers and the cords that will sometimes come on covers. So about every month, a child in the US dies from window cover cord strangulation. So those little cords that come down for blinds. Because they're longer than 7 inches, sometimes children will play with them, get them caught around their neck, and then accidentally strangle themselves. Massachusetts has a policy in place that aims to eliminate the use of those cords to begin with. But a lot of older homes especially have coverings that are several years old and therefore are not up to date with the regulations and will have those cords. I know in my house, I don't have any small children, but I would say about half of the window covers I have are cordless. The other half do have cords. And so if there were to be small children coming into my house, I would definitely want to make sure I'm changing those out so that there is not a strangulation risk. So if you live in a home with children under 10 or you have children under 10 coming over a lot, you want to inspect your window blinds to see if they have those cords. They're going to be either on the front, the side, or the back of the window blinds. If it's longer than 8 inches and in a continuous loop or not secured to the wall, so like anchored to the wall, that can be a hazard for young children to be playing with. So you definitely want to get cordless blinds when able. There's a certification that says best for kids on a lot of cordless blinds, and that's the type you want to get if you're going to replace your blinds. So if you cannot replace your blinds, if that's not an option, you want to pull the cords as tight as you can and make them as short as possible. And then you're going to put them up high and anchor them to the wall so that they're not loose or dangling. You'll always want to keep those cribs, beds, and furniture away from the windows. That is so kids are not playing with windows, and so they're not playing with blinds or the cords that come with blinds that could get wrapped around their necks. There is also something called a retrofit kit, and so essentially, if you do have those cords on your windows and you're not able to get new covers, you can get things like tensioners, inner cord stops, or breakaway tassels to make them safer. So that's going to look like fixing it so it's not in a continuous loop, maybe shortening it, um, or getting breakaways so that if it is in a continuous loop and there's pressure, it's going to break away. If you are interested in getting a retrofit kit for your cords, you can reach out to windowcoverings.org and you can request free retrofit kits. It'll ask you what type of cords you have and what type of retrofit kit you're looking for, but they'll send you a kit in the mail and then you can make those cords safer yourself if buying cordless blinds is not an option for you at this time. So, just to conclude a bit of what we talked about, although window falls and window cord strangulations are a bit uncommon, the result of them can be very deadly. Through safety practices and the correct use of safety equipment, these injuries are 100% preventable. If you're a renter in Boston with windows 12 feet off the ground or higher and children under 10, ask your landlord to participate in the Boston Public Health Commission's subsidized window program. All right. And then this QR code goes to the injury prevention webpage that has a bit more information about what we all covered today. And I believe that is all I have for today.
Right. So Emily, wondering about so there's a lot of you need to have your landlord's buy-in in order to have these window guards installed, right?
Yeah, so we recommend that the landlords themselves purchase them since they are the owners of the property. But even if the landlords are unwilling to, tenants can purchase them. However, since you are drilling into the wall in the landlord's property, it is important that they at least give you permission in order to do that. Yeah.
Yeah. Yeah. Wow. Yeah. So as far as the summer months,
Mhm.
I'm sure your injury prevention work is in full swing to prevent any of, unintentional injuries from window falls is happening. Uh,
Mhm.
how do you usually disseminate your information so that you're in front of the people who needs the information and who needs to hear the information?
Yeah, so I try to take every opportunity I can to talk about it. I like to attend resource fairs, so there is one that ABCD is doing this Friday that I'll be at tabling with our brochures that specifically are talking about this program. But I also, if I'm in the community doing workshops on home safety, I always like to highlight this program. And a lot of the education comes from partners like you and other people on our Safe Kids Coalition who are working with a lot of families in the area who maybe don't know about this program or even what window guards are.
Hmm. Yeah, yeah. I think it's just very fascinating. And as far as the window cord strangulation, that's never really occurred to me, but it does make a lot of sense.
Mhm.
Makes a lot of sense. And so um, I'm thinking if if children can choke or get strangulated from the cord, is there also such a thing as a window, like a curtain strangulation, if the curtain's long enough? I guess.
Yeah, a lot of times, like those curtains, like back in the day that had those like ropes that you would tie them back with, those are obviously still because the cord's longer than 7 inches, definitely a strangulation hazard. And so any curtain that has a cord like that, is going to be a hazard to small children.
Wow. Very interesting. Yeah. So what other initiatives do you have along the lines of prevention for children, pediatrics? I mean, I know this is Aging Strong is more for older adults, 50 and up, but a lot more older adults are babysitting maybe for their own children's children. or
Mhm.
helping out to look after. So it's always good to have these safety ideas in mind, right? So
Mhm.
what other programs do you have that you're involved with?
Yeah, so we focus a lot on education. As I said, of course, having the window guards is one of the most important things you can do. But if that's not an option, there are still steps you can take. And so, similarly, with things like safe sleep, talking about the ABCs of safe sleep and how to keep an infant safe. We talk a lot about, just home safety in general, what kind of equipment you should have for what ages, the possible risk factors that can come up in the home for young children. That's a big thing we talk about in our educational workshops. And then, as for programs that offer more of the equipment type of intervention, we have a helmet program as well. And so we work with local organizations throughout Boston. So like the Austin Brighton CDC, Mattapan Food and Fitness Coalition. Those are both some of our organizations that repeatedly will participate in our bicycle helmet equity program, and they'll distribute helmets for children. But even people of all ages can get helmets from them. And so that's one of the interventions that we do to make sure that kids are being active and healthy and also being safe.
That's good. And you said it's for all ages, pretty much, right?
Yeah, yeah. There's no cost to our bike helmet program. We really try and target it towards children because they have less capacity to buy a bike helmet if they need to, but it's not like a specific requirement that you have to be of a certain age in order to benefit from the bicycle helmet program.
Oh, that's great. You know what? I'm seeing so many people on the electric scooters,
Mhm.
bicycles, um, a lot, a lot of people, more than I'd like to see, are especially adults, uh,
Mhm.
do not wear helmets. And some of them even have their children or a child, with them with
Yeah.
helmets. And I get so scared for them. They
Yeah.
go so fast sometimes.
Yeah, and especially in Boston, there's literally a map on boston.gov that will show you every intersection in which there was a bicycle crash or a car crash or a pedestrian crash. And so we know that that happens a lot and definitely a lot more than we're comfortable with. And so we have a lot of helmets to try and reduce that number to zero and to also try and make the street safer.
Yeah, that's good. That's good. I can imagine the helmet um uh events that you hold is not just a summer thing. It should be. I mean, I'm sure you do it all year round, right? Because
Mhm.
New England weather is so changeable. We could even bike sometimes during the winter months.
Yeah.
Yeah. Can you speak a little bit about the safe sleep? You mentioned that.
Yeah. So the ABCs of safe sleep are essentially you wanting a child, specifically under a year old, to be alone in their sleeping place, which is going to be either a pack and play, a crib, or some type of bassinet. Having like little blankets or toys can be suffocation hazards. So you don't want anything other than the baby and maybe like a binky in that area. And then the B stands for back. You always want them flat on their back because, again, if they're on their side or on their stomach, then that is going to be a suffocation hazard. And then C stands for crib. You want them in a crib or some type of space with a mattress that is flat and firm. Sometimes we'll see co-sleeping at a young age, which is less than one. That can be really dangerous for a child, especially if there's like a lot of blankets. We'll sometimes see children rolling off beds and then dying from getting like stuck in between the wall and the bed. Sometimes parents may roll over on their child, or a child may roll over in the bed. And with a lot of bedding, that can be a suffocation hazard. With SIDS specifically, we can see that there's a higher incident rate of SIDS if you do not follow the ABCs because it can increase their chances of like a type of sleep suffocation or um, just SIDS taking place. We don't know a ton about SIDS, but essentially there's a trifecta. And so there's the biological reasoning behind SIDS, and then there's an environmental contributing factor. And so if you don't follow the ABCs, it can raise their risk factor for the environmental factors. But yeah, so we definitely want children in a crib, alone, and on their backs.
Yep. Gotcha. All right. As a new grandmother, I'm taking good notes here. I'm taking good notes.
Yeah. Yeah, and it has been really interesting to see. I would say Safe Sleep really picked up, just being a part of education in the 90s. So a lot of people who haven't had kids since, maybe the 80s or the 70s don't really know a lot about the ABCs, but they have greatly reduced the incidences of SUIDs, which is suddenly unexpected infant deaths.
Wow.
So we really encourage people following the ABCs because we have seen a really great reduction in them.
That's good. And you said A is what again?
Alone,
Okay.
B is for back, and then C is for crib.
Very good. Yeah. Okay. Very good. And the crib, I know from having children years ago, the slats, you mentioned slat space, right? Between the two little poles there. It has to be a certain amount. And I
Hmm.
mentioned that with the window guard. So they've also changed that with cribs. They made it so that a child's head can't get stuck in between.
Yeah, yeah. It's interesting. I think about 10 years ago, maybe a little over 10 years ago, there was actually a lot of regulation put into making cribs. And so if a crib is older than 10 years, a lot of times we recommend that it's not used because it may not be up to the standards and the regulations that are now in place.
Yeah, that makes sense. So it has to do with the child falling through that space. So whether it's a crib, their head getting stuck in between the slats, or the child getting caught in between the unfitted the mattress being too small
Hmm.
for the crib, the child can get stuck in there, or the window guard that you're talking about. So space is really very important, right? So
Hmm.
the magic number would be what? Less than 2 inches or 2 inches?
I think typically they're going to say less than 2 inches. I don't have the specific requirements pulled up, but yeah, typically if it's less than 2 inches, child's not going to be able to get through it.
Yeah, yeah. Now, I'm going back to your window presentation, the window falls. To prepare for this program, I was listening to a webinar, and it seems it's not just a United States issue. Other countries have this issue. It's a global one, right? Yeah.
Yeah, yeah. Unintentional injuries, as you know, are the number one killer of children, and it's a worldwide issue too.
Yeah. And as far as being in Boston, are there pretty much any hot spots, any areas where you feel like, okay, we need to pay extra attention to this particular area and make sure we're more visible, we increase education, awareness around, window falls. Do you have
Mhm.
any data on that or?
Um, we are working to get more data collectively over the past several decades put together, but in general, we really try to make sure our resources are going to some of the less served communities in Boston and those that have lower incomes and therefore less opportunities. Luckily, we have not seen a window fall in the city of Boston in think about 2 years was the last one. And so we see a lot more. outside the city or in smaller cities in Massachusetts that maybe don't have a program like this. And so luckily we can see that, even if we don't have a lot of the data at hand, only having one in the past 2 or 3 years speaks volumes from, 30 years ago when we were having 18 in the span of 6 months. So we really do see that having window guards in place, and we've again put hundreds, probably thousands, into different homes and communities in Boston, and so we know that they are working because we're seeing a reduction in falls and window fall incidences in Mass or in Boston.
Oh, that's wonderful. What is the time frame between the time that the landlord purchases the window guard and installation? Is it pretty
Um,
around time pretty much fast and
Yeah, so we don't have people who are installing them. So if someone goes to Boston Building Resources, the landlord shows ID, meets all the requirements for the subsidy, they can purchase the window guards as long as we have what they're looking for in stock, and they can leave Boston Building Resources with their 10 window guards. And if they want to go to the property and install them, that's completely up to them. And so, yeah, it's really just up to whoever the landlord wants to install them in their time frame.
Oh, okay. Okay. That makes sense. So that way, okay, so that would make the turnaround time pretty fast. Then you don't have to wait for a work order to hire a contractor or a carpenter to install. So
Hmm.
so the landlord would measure the window and it would
Hmm.
be outside the inner window frame. And from that, they would contact the organization
Hmm.
and then they pick up how long does it take once they put in the order? Can they just pick it up right on the same
Hmm.
day?
Yeah, so we have, I believe we have about 200 in stock at the moment, maybe a bit more, but typically, someone will just go to Boston Building Resources in Roxbury, as long as they know how many they need and of the measurements they need, and then they can show them their information, purchase them, and then take the window guards home with them.
Well, that's good. So the landlord, what type of identification do they need to bring? Their ID and
Typically, yeah, proof that they're a Boston resident. And then for landlords, there's some specific requirements about the rate in which they can receive the discount for. And so typically, I believe it's 6 units or less they can get the special discount for because they're then considered a small landlord. And then if they're a bigger corporation that's maybe, well off, has a few hundred units, then they're typically expected to pay a fuller price than someone who's maybe, just owning a unit or two.
oh, that makes sense. And how many years does the landlord need to be a landlord? Is there a new requirement? Do they have to for
There
1 year?
isn't a requirement that I believe we ask around that as long as they, you know, own the property or have permission to install the window guards and are a Boston resident, then we can sell them.
Okay, that makes sense. Oh, that's good. That's very good. Yeah, that's good. I'm really I hope other cities and towns around Boston will be able to get inspiration from what you had to share today. So that way, they'll be able to take action. So, if like say cities and towns like Milton, Weymouth, Randolph, or even across Massachusetts, Lenox, Mass, they watch this program, get inspired
Mhm.
and are noticing that the rates are starting to go up, children falling out of the windows, unfortunately. Would they contact you, the department, just to see how they can start initiating or establishing a program such as this?
Yeah, yeah. If there are other cities or towns that are interested in doing a similar program, they are definitely welcome to reach out to me, and I would be happy to meet with them and talk a bit more about the program and what it looks like behind the scenes.
Oh, that's good. That's good. That's good. Um, Now, do you also, as far as, this is the window safety, any other initiatives that you're involved with as far as the summer? You mentioned sleep, you mentioned, was it sleep, the window safety, bike helmets, any other initiatives or any initiatives that you would like to start adding on to what you're already doing?
Well, so the city of Boston, specifically the mayor's cabinet, they do a lot of work around drowning prevention. And so that is definitely a city program that I want to uplift, and I love, helping uplift that and working alongside them however I can. And so they offer swim lessons through different organizations, and they pay essentially for children to get free swim lessons. The swim lesson signups do go pretty fast. There's a very big need, especially in Boston, for swim lessons. I know that it's estimated like a month of swimming instruction can really, really greatly reduce a child's risk of drowning. So we really encourage children to get swim lessons however they can. And then there are like other things like life jackets that children can use and different precautions to put into place. But July, I believe, is Drowning Prevention Month. And so we'll probably do some social media communications around that. But yeah, the swim lessons and the drowning prevention work is really important, especially in kids under 5.
Kids under 5. Okay, wonderful. That's great. So what organization do you partner up with in order to, provide these swimming lessons?
So the city, specifically the mayor's cabinet, they have a grant that opens up every spring, and different community organizations will apply for it. I'm not exactly sure who's on this cycle, but I know Dot House in the past has been a partner in this program. And a lot of BCYF facilities have swim lessons as well as swimming pools. So yeah, I can't say for sure who's doing it this summer, but those are a lot of places in the past that have participated.
Okay, so these are more for indoor pools, the swimming lessons, right?
I believe so. I'm not exactly sure what all the facilities look like, but there was a really big water safety event last summer at a BCYF facility, and they mostly do indoor swimming lessons at the facility I went to.
Yeah, I mean, I can imagine that it would really fill up fast because not only are children learning a life skill, um,
Mhm.
but it's a good way to cool off during the hot summer months, right?
Yeah, yeah. And a lot of swim lessons too are very expensive. And so it can be really hard to, um, just have the ability to afford that in general. And especially if you're lower income or, don't have as much to spend on, swimming lessons, it can be really hard to get that education for children.
Yeah. Now I'm wondering if there's any correlation now as far as like, a pseudo or mini water park in the Boston area. I know there's some areas in Boston where they have like, like you would walk through and there's like fountain spraying, you see little
Mhm.
kids playing there. Is that would having more areas like that in the city, would that reduce heat related unintentional injuries? Maybe reducing dehydration, heat stroke, maybe um, kids falling out of the window. I only say that because if they're outside cooling off, maybe they're not inside in the hot, building with the windows open. I'm not sure if there's any type of correlation.
Yeah. Yeah, I'm not sure exactly. I know there are several splash pads around Boston, and kids seem to really like that and to have the ability to cool off.
What's it called? Splash
A
pod?
splash pad, I think, is typically
Oh,
what they call it.
yeah, okay. All right. All right. I know even as an adult, I love walking through those.
Yeah, yeah. The little mist of cold water when it's hot is really nice.
Yeah, I mean, wow, it's just fun altogether, you know. So it's a nice way to gather people. So, what else do you see happening as far as your injury prevention work and any do you find resources or funding being enhanced or being reduced with the changes and that's happening in the economy these days?
Yeah, luckily for the injury prevention program, for BPHC, we are fully funded by the city. So our funding is not, based on any other organizations. So, I don't see our particular funding changing, in the near future. So we should still have the window guards and the helmets, and all the other programs that we are continuing to do, should not change.
Thank goodness, right? Oh my goodness, yeah. Yeah, that's wonderful. It's such a need. And are the number of children, what's the rate? Is there a rise in children, the amount of people living in the Boston area? Has there been a recent baby boom that now all of a sudden there's 25%, I'm just throwing out a number of children under 5.
Yeah, I have no idea. That's a really good question. Yeah, I'm not sure if there's, increases or decreases in the amount of children. I feel like I see that there's always a need, and so as long as there's a need, we're gonna have our window guards and our helmets and do what we can to meet that need.
Awesome. Awesome. Well, we're almost at the top of the hour. So, what are the some takeaways that you want people to have based on what you shared with us? I know you talked about window falls and strangulations, but then I teased out a few things that you specialize in. So, just give us, some tips and also maybe some key takeaways.
All right. It's a good question. I would say something that I really hope people take away is that, like education goes a long way, and those little habits, they really do create a safer home and a safer environment. So regardless of our income status, the way that we open windows, making sure that we don't have mop buckets with water because children can drown in as little as 2 inches of water. Making sure, toilets are closed or locked if able, that outlets are covered, that, furniture isn't beneath windows, that there's 5 feet of space between a child and the stove at all times. Those little habits, can really create a much safer environment. And so, um, even though like there is like wealth disparities, I would empower everyone to take control of what they can with these little health habits. To also know that there are resources in place, and a lot of organizations and people that want healthy and safe homes, and for people to have things like window guards and who are willing to, do what we can to make, Boston safer, Massachusetts safer. And so if there is, a safety, um, sorry, a safety supply you're looking for, don't be afraid to ask about it. I know too, a lot of people, don't take a lot of, or don't take all the benefits of their insurance. And that's really important to know. Most mass health plans do offer free helmets. A lot of them have car seat programs or booster seat programs. And so a lot of times these things are in reach. It may just be an information gap. And so, yeah, if families need safety supplies, reach out to their insurance, reach out to, nonprofits or, city agencies. I'm sure there is someone along the way who is, going to have that information that you're looking for.
Oh, that's wonderful. Are there any community champions who are bilingual who can basically share the information that you have to share for different populations who, our residents are in Boston area. As you know, there's so many different groups who may need the resource
Mm-hmm.
that you provide, but may not understand English.
Mm-hmm. Yeah, I know our mayor's health line, we have a language line. We also have a few different staff members who are native Haitian Creole speakers, native Spanish speakers. So they're always welcome to call, especially if they have questions about different insurance plans. And then I believe most hospitals and insurances should have language lines as well. And then as for, in-person people on the ground, a lot of community health centers have bilingual representatives or hopefully language lines that they can get people in touch with.
Wonderful, wonderful. And, of course, as I'm saying bye to you, I have another question in mind. One last question. So what would happen and what would it look like if, heaven forbid, a child was admitted to the emergency room under 5, had a mild brain injury, and being discharged, they don't have a window guard. Who would be the one to provide them with the information? And who would be the one who would kind of evaluate, okay, how did they fall out of the window? Was there a window guard? So would it be the social worker? The who
Mm-hmm.
who would
So
be the one to connect them to outside resources?
Yeah, so that's a great question. A big thing we see is it's very municipality dependent. So as of now, the state of Massachusetts, as far as I know, does not have a law regarding window guards. There is currently one that is in the House. They've tried to pass many different laws to mandate window guards in the homes of renters. However, nothing has passed yet. So I would say the majority of falls that practitioners are seeing in, MGH, Children's, whatever hospital these kids may end up at are going to be outside the city of Boston because we do have a window program. If the child falls in the city of Boston, um, my boss, Eugene, and I are going to be getting a call from Boston EMS to arrive on the scene, to inspect it, and to look over the scene. But because different municipalities have different laws, I would assume that, there may be instances where kids are falling and, maybe local government officials are not going out because that may not be an ordinance or a law, depending on where the child is falling. So yeah, it's very dependent. But on the rare occasion that happens in Boston, we do have people from the city that are going and looking into it.
Good, good, good. Again, it's my hope that, as people from different cities and towns across the Commonwealth and even outside of Massachusetts, as they watch this, they, can take action, whether, in the political realm or in their own home, their own space, to, promote more safety. So, thank you so much, Emily, for being on the Aging Strong program today. I really learned a lot, and I know a lot of people who are going to be watching this program will learn a lot too.
Yeah, well, thank you so much for having me.
Oh, you're welcome. You're welcome. So I also want to thank the Quincy Health Department for sponsoring Aging Strong. So until next time, everybody, be well and keep safe. Take care. Bye-bye.